Hi.
Hello.
We're live.
We're back.
James Southwood-Keeley and
Lisa Rush, and we're doing our first of our Body Beautiful series tonight. So
Cool.
all about tightening and lifting.
we're doing this for Wallara Health and Beauty. Remember, we're the big blue building on Edgecliff Road, just down the hill from Bondi Junction. We hope to see you soon. So, tightening and lifting. It's a
Something-
huge topic, isn't it?
Huge.
It's a huge topic. But we thought tonight as an introduction, we'd just talk about eyelids,
Yep.
necks and tummies. So in common they have the aging process, which is kind of universal from head to toe. But what is it that causes aging? Is it a single thing? Did I eat the wrong thing at that Chinese takeaway back in 1983? Is that why this is all going to pot? What causes the aging process?
Look, there's a number of things that can cause the aging process. So we've got obviously our intrinsic factors. So our genes are a huge player. So you've got mum and dad to thank for that droopy eyelid and things like that as
Yeah,
well.
for better or for worse.
we start to age. You've also got then your extrinsic factors, things like your sun exposure, lifestyle factors. So yes, lots and lots of Chineses over time could potentially affect
Greasy food,
how
bad
we do
food,
age.
too much sugar, too much fat, smoking, not getting enough sleep. This time of the year is tough. Lots of parties, drinking more alcohol than we should.
Yeah, absolutely. And so tonight we're just going to give that brief overview, and remembering this is about you. So any questions, please do ask us as you go along. Like, share, and yeah, let's try and make this as interactive as possible. We did do a Facebook Live a few weeks back on sun damage, and we did get some interaction, which was really good.
Yeah, keep the questions coming.
Yeah.
So I like to think about aging when I see a patient in front of me in terms of layering, because essentially we as human beings, we're just a composite, a multitude of different tissues that are all bound together that makes us what we are and who we are. And so in analysing the ageing process, I look at the skin, I look at the soft tissue layers under that, the muscle and the fatty layers, and then I look at the bone as well.
Yeah.
And I think that helps me, and no doubt helps you too, in kind of tailoring a treatment plan for patients.
Yeah, so every time we have patients like yourself come into Wallara Health and Beauty, it's all about, a total face or a total body approach. So, it's about listening to what your particular concerns are for areas, and then when we do our assessment, we obviously have to look at different factors, as you've already mentioned. Is it skin elasticity loss that you're suffering from? Is there changes to the volume in the area? And as we start to get a little bit older, into our 50s, 60s, we've also got to consider things like bony changes. So eyelids, let's start with eyelids.
Let's think about timing. I think this is really important.
Yeah.
Because I think if you want to be subtle about what you're doing, you want to look good for a prolonged period of time, less is more frequently, and that's the answer. So I always think about timing.
Yep.
As you've alluded to, tailoring. You don't just have a recipe that everyone gets who walks through the door. You really want to target those problem areas for the patient. And then the technique, the 3 T's. So is there going to be a non-surgical approach, or are we going to need to fall back on the sharp blade?
Absolutely. And every time, younger clients come in, it's about educating you on looking after your skin and, incorporating as many anti-aging strategies as possible. So loose skin, what do we do with that? We all tend to start to notice a little bit of our drop in our brow and upper eyelid.
Yep.
Mid-30s, late 30s, definitely into our 40s, 50s with some clients. And so, a common thing people ask, what can I do to lift? What can I do to tighten? So some of the common procedures that we tend to do in the practice, non-surgical procedures that I do myself, are things like anti-wrinkle injections. So we know that the muscles in and around the eye can also contribute to a pulling down of that area, and when we selectively use purified protein to relax that muscle, often we can get a little bit of a lift in the area. So that can be one way to lift, brow lift.
And smoothing out the wrinkles around the eye as well.
Yeah,
That's
of
really
course.
helpful
So we've
too.
got a number of benefits with it. Skin integrity. So my younger clients, when they've got good skin elasticity, let's think about ways that we can boost your collagen and elastin and keep that skin nice and tight. So we're delaying those other procedures for as long as possible. But
recruiting the body's own natural healing process to bolster the collagen, the elastin, the strength and elasticity in the skin. That does a lot of the hard lifting for us.
Absolutely. So things like dermal stamp, skin needling is really good for the face in and around the eye area.
Yep.
However, we can't go too close to the upper eyelids. So, if we do have people with a little bit of a concern about some elasticity loss in that area, I tend to reach for things like the Ultraformer, which is the ultrasound skin tightening.
Yep.
Really safe to use on the brow bone. It doesn't use any form of light or laser, so our actual eye is quite protected.
Yep.
And again, it's really good at stimulating collagen in that area.
And we'll come back to this maybe later, but is it uncomfortable for the patient?
Look, everybody has a different pain tolerance,
Yeah.
but it is a relatively comfortable procedure, and particularly in the upper face area, in and around the eye area, I find that it is tolerated really well.
Excellent.
However, there is some degree of heating at the deeper tissue, and that's how it works. The ultrasound waves hit the resistance of the skin, which then causes a heating of that collagen at a deeper level. So you definitely feel something happening. Some people experience it as a kind of prickly type heat sensation, but it's really short-lived. There's no downtime afterwards, and pain is not usually an issue for the upper face area.
Brilliant.
Yeah.
And what happens when that poor patient's gone just a little bit beyond what we can do non-surgically?
Yeah, so
What are some of the signs that they say? What can you do when you say, you know what, over to James?
your turn. Well, as part of the assessment, in particular around the eye area, when I'm looking at the skin integrity, first of all we do something called a snap test. So we literally just lift up the skin, and if it doesn't return to its normal state within a couple of seconds, and it's still kind of tenting a little bit, I know that there's quite a moderate amount of skin elasticity change in the area there. Again, with the height of the upper eyelid and the brow, if we find that it's descending down and that upper eyelid starts to touch the eyelashes, I know that, the non-surgical stuff is not really going to give a dramatic change to the client, and so that's when I really need to pass over to you to have a chat and see what other options they can do, as well as the non-surgical treatments.
In terms of surgery, that might be a brow lift where the brow is elevated and then fixed permanently, as we can do temporarily and reversibly with things like Botox. And then the eyelids, the excess skin of the eyelid can be trimmed away. Sometimes a little bit of fat's removed, but that's a more old-fashioned approach where more fat was removed. It left patients with very hollow eyelids. So really we try and preserve all the fat that we can, and it's mostly about removing the skin. That skin that sits down on the lash line when it's in excess and too saggy.
And what's the recovery period like for that, James?
So the surgery itself for the upper eyelids takes about an hour. You go home the same day of surgery, and then you're back at work basically within a week. You see me within that 5 to 7 day time frame, and I remove some sutures. Sometimes there's a little bruising, oftentimes there's not. And certainly within 1 to 2 weeks you're looking really fab, and then within 6 to 8 weeks you're looking great.
Fantastic.
Yeah. What
So
about the neck?
we're moving down.
Yes.
So again, with the neck area, it's
Can I just interrupt for a moment?
yes.
People's faces can look amazing, right? But the neck's a real giveaway, isn't it?
I agree.
In the media, these great airbrush photos, it's tough to make that neck look good.
Yeah,
it's often
absolutely.
a big giveaway.
We've got to look after this area too. And again, as part of our assessment, we've got to go, okay, well, what's making our neck look aged? How
Yeah.
can we lift and how can we tighten it? So skin changes, again, we can
Too
look
much
into
skin,
our
wrinkly
elasticity
skin.
loss. We get downward pull of the muscle in the area, which can
Yeah.
contribute to the sagging. We lose definition of our jawline, which again can, further, increase that sagging to the area. And also if people have a little bit of excess fat as well, that
Absolutely.
can affect how a neck looks. So what are the treatments that we tend to reach for? So same as the upper face really,
Yep.
except slightly different in terms of how we apply it and where we apply it. So skin tightening treatments, so
Yep.
ultrasound skin tightening, excellent for tightening and firming the area. If people do have a little bit of excess skin, non-surgically, there is an injectable treatment that helps to dissolve some fat in that area there.
That's a relatively newly
It
released
is,
treatment,
yes.
isn't
So it's been in Australia since last year, but it has been in the States for quite some time, and it was actually renamed differently in the States. But an excellent choice if people aren't quite ready to do a surgical option. However, there is things like submental liposuction, which you can
Yeah.
potentially do if patients need that. Another thing for the neck area is, again, we've got big muscle bands that go up our neck, into our jawline, and again that does have a downward pulling action. So
you tend to form those cords.
I'm actually a really good patient to see. So I mean, when I clench my teeth, you can see these bands here, and so when people...
Oh, look at that! It's horrific.
We need some anti-wrinkle injections. But when patients do have quite prominent muscles in the area, you can do a little bit of anti-wrinkle injections into the bands, which we call the platysmal bands, and actually a little bit into the jawline to tighten that area. And it did have a great name, actually. It's called the Nefertiti lift. So we all know that Nefertiti had this amazing jawline, so that's what they've kind of named that procedure.
Yeah, you've got to be careful with that because it's a relatively large dose, isn't it?
I agree,
and if you're not positioning those needle injections accurately, and it goes deeper than the muscle, it can affect your ability to speak and swallow, and that's a real disaster.
So it's a very advanced technique.
It's an advanced technique. You do it beautifully, I know that, and so long as you're in good hands, you're well looked after, you'll have a lovely result.
Yeah, so surgically, what can we do
surgically? Okay, so look, you've touched upon the submental liposuction, and that can be a one-stop shop. It does cause a little bit of bruising and swelling, but over time, with the soft tissue remoulding and settling, it produces a lovely result with very little downtime, in effect. Then if there's excess skin in the muscle bands, they can be attended to surgically as well. There was a whole trend of thread lifts and all sorts of minimally invasive techniques, probably going back a decade or so, and effectively they don't last for more than 6 to 12 months, and I don't waste my time with them. I think it's a waste of patients' money and time, and if you need to, and if that's the way you're going, considering a neck lift is the way forward, because that will re-drape the excess skin, it will attend to the muscle bands and eliminate those, and you can also deal with any excess fat at the same time.